Now, the next person I get to introduce is from yet another vendor that I have had the opportunity to use this service from. Has anybody here used AmeriDoc yet?
Woo, yeah!
That was a wave of the future. When that came out and I thought, I don't have to go to the doctor's office, that is great. I have 5 children. And my daughter had pink eye, and I've seen pink eye before. Doesn't take a doctor to tell me what it is. And I had called up and the doctor said, well, is it this, is it that, is it the other thing? Yes, yes, yes. Okay, let me just call in a prescription for you. And I didn't have to bring her to the doctor. I just went and picked the prescription up, and that was it. And it's included in our plan. Another one of my daughters, sitting on the ground outside, the grass makes her legs a little itchy, and she gets a red rash on her leg. So I had called AmeriDoc and said, hey, she's got a rash. He said, can you take a picture of it? And I thought, sure. I took a picture with my iPhone, loaded it up onto the site. They took a look at it, and he said, oh, it's an allergic reaction. I can call you in a cream. Didn't have to go to the doctor, yet another coup. So if you have children, you'll find it's very nice to use the program. Also, when they're not all that sick, you don't really want to bring them into the sick waiting room because then they get sick. So it's nice to be able to use the program. She's going to explain a lot to you today, but she's also going to give you some really great sales points for you to bring out on your presentation. So let's give it up for Stephanie Manley from AmeriDoc.
At AmeriDoc. I've been there pretty much from the beginning, from the first client on the books, and currently have about 1.2 million members. AmeriDoc is a nationwide telemedicine provider. We currently treat common and acute illnesses over the phone. So, just as Kelly was saying, you can call in, speak to one of our physicians, and we can issue a prescription right over the phone. Today I'm going to go over a few things about AmeriDoc. I'm going to go about the member login, how you can store your medical records, the types of consultations that we offer, and also that you have access to all this information at your convenience. What is the benefits of a telemedicine provider? It's great. For one, access. At 2 o'clock in the morning when your child wakes up with a fever, who wants to run to the emergency room and wait for 3 hours to see a doctor? Well, I know I wouldn't. I'm going to pick up the phone and call AmeriDoc, and usually within about 30 minutes, my phone will ring, and it will be the physician on the other end, ready to assess my issue. Convenience. All of us work, all of us need money. No one wants to leave work and go to the doctor's office. We don't need to miss work, so what better than slipping off to the bathroom, calling in, or on your lunch break, calling in, and a physician will call you right back. Then after work, you can run in and pick up your prescription. It's great. Save money, no denials, as well as state-of-the-art physicians. Patient tracking, what makes us best in class? Here, all you have to do is call in. All of our customer service representatives are medically trained professionals. These girls have worked in a clinic setting. They're all HIPAA certified, as well as they are all licensed in some type of medical field. We have a physician manager that is also on call every day with these girls to make sure that there's no escalated issues, to make sure that your prescription does get called into the correct pharmacy, and of course to deal with any physician services that we might have. I don't know if each of you have gotten to speak to one of our physicians, but I believe that we have the best physician network throughout the telemedicine marketplace. Our physicians will take the time to get to know you in a matter of 5 minutes. They're going to ask you all kinds of questions. They're going to treat you just as if you were in their office. We are the only telemedicine provider that provides a post-consultation survey. So when you call into our service today to have a consultation, we're going to call you back tomorrow and ask you, were you satisfied with that physician that spoke with you? How can we make this experience better for you? And of course, would you refer us to a family member or friend? We want to increase our service and our professionalism every day, so we take that feedback that you give us, we take it to the table and try to improve our services. So, what does AmeriDoc offer? Well, like we said, you can pick up the phone and call in and request a consultation. But we go further than that. We are going to give you the ability to log into our platform and view your medical records at any time. We provide you with a username and password. You come here to the AmeriDoc homepage. At the top, there's a member login tab. You simply enter your information right here, and it will take you straight back to your personal health records. There you can store any of your electronic health records from your primary care physician, maybe a specialty physician that you've seen. All of that can be stored right in their platform. What do we offer? Lots of good stuff. So you need a prescription, you can call in. You need to find out what to buy at CVS or Walgreens, we can do that too. You call into our service and you say, I'm over at CVS and I don't know whether to buy the Sudafed or the Mucinex. Or maybe can I take both at the same time? All we're going to tell you is, just 1 second, Ms. Jones. We're going to connect you to a U.S. licensed physician and you can ask him as many questions as you would like. There is no wait time. So while you're standing in the aisle at CVS, we'll have a physician on the phone with you and say, hey, you know what, you have high blood pressure, maybe you should go on aisle number 7 and pick out the other medication. Although it's usually utilized by generalized questions, I must share with you a very touching story that touched everybody in the office. I had a gentleman call in at 3 o'clock in the morning last August, elderly gentleman. He said he thought he was having indigestion, wanted to know if he could take an extra sleeping pill because he said he felt fidgety. Once the physician got on the phone with him, in 37 seconds might I add, he began to ask him a series of questions. He said, do you have high blood pressure? Do you have diabetes? Have you ever had a heart condition? Tell me how you feel. After speaking to him for about 2 minutes, the physician now realized that this gentleman was having a heart attack. He told this guy, he said, I want you to put your wife on the phone right now. He put his wife on the phone, and he said, I want you to take your husband to the hospital right now. When you get to the counter in the emergency room, you tell them, I've already spoken to a physician. He thinks I'm having a heart attack. So they did that. They drove right into the local emergency room. That gentleman spent the next 6 weeks recovering in the hospital from that heart attack. What makes it even better, the ER physician that treated him in the ER called my office the next day. And his exact words were to us, what in the heck kind of service do you have where a patient can call in at 3 o'clock in the morning and speak to a physician about the conditions they're experiencing? Did you know that if you pick up the phone right now and you call any emergency room around here and ask if you can take Tylenol for a headache, they can't give you that advice? That's what AmeriDoc does. We save lives over the phone, we give you that simple advice. Maybe your mom was diagnosed with diabetes and you just want to know, hey, what's my chances of getting it? What do I need to do to prevent myself from getting it? All that can be instantly answered by a licensed physician. It totally overrides a nurse hotline, right into a physician's line. So the diagnostic consult, that's the most popular. I recognize a few of you's voices when you come into our vendor booth that have used the service. By the way, thank you very much for all the compliments, we love it. Majority of the conditions that we treat are common and acute. Your fever, cough, rash, sore throat, vomiting, diarrhea, headache, pink eye, all of those conditions that you usually run to the doctor for, either wait for an hour and a half to see the doctor, pay a $150 office visit. What's better? Pick up the phone, call in, we'll treat it right over the phone. There are some things that we cannot treat. So don't go tell everybody that we can cure the world, because we can't. No DEA-controlled substances, the good drugs, they say. No narcotics, and no lifestyle medications. And when I say lifestyle medications, I'm talking about birth control, weight loss medications, smoking cessation, those voluntary medications that you can choose to take. We do also refill chronic illness medications. So I'm sure we have some hypertensive patients in here, some diabetic patients. Maybe you get a flare-up of gout. Maybe you have arthritis. And you take a maintenance drug on a regular basis for this condition. Well, let's say that you don't really care about going into the doctor today because you've got meetings all day. Well, you can skip that doctor's office and call into AmeriDoc, and we'll actually refill that prescription for you. So, no need again to spend the money. You can call right in and we'll do it for you. So, how does this all work? It's very simple. Pick up the phone, dial our toll-free number. When we answer that phone, we are going to treat you just like you're at the doctor's office. Oh, hi, Mrs. Jones. Can I get your first and last name and your date of birth? They say, oh yes, my name is Stephanie Jones. My date of birth is 12/12/80, whatever it might be. And you can see on the screen we have a My Account platform. We will store all of your information there, your email address, your phone number, all of that information can be stored in your profile for your records. So each time you get a new member sign up for AmeriPlan or in that plan design, they will receive an electronic fulfillment. Electronic fulfillment that states, welcome to AmeriDoc. These are the services that we offer. When to use us, why use us. All of that will be there for them so they can refer to it. All they ever need to do is log into their platform. Under their mailbox, they will see that fulfillment piece. Now here you can see that when you log into your profile, you can actually view all of your scheduled requests at any time. Let's say that you scheduled a consultation for 8 o'clock tonight. If you wanted to log in and sneak and say, I wonder what doctor they gave me, you can actually do that. You can see that it says Dr. Stephanie Manley has been assigned to this consultation. And it actually tells you that the doctor's going to be calling you in about 54 hours, which hopefully that would not be the case. But with this one, it's scheduled for ahead of time. And you can see all of the information that the customer service representative typed in. Why are you calling in? Do you have a sore throat? Headache? So, electronic health records. Every doctor's office is going to electronic health records. We have our own. Every time you call into our service, we are going to update this information. Just like when you go to the doctor's office. The first thing they do is put you on the scales and weigh you. Then they measure you. Then they pull you in the room and say, are you taking any medications? Are you allergic to any medications? We are going to do all of that right over the phone so that we can provide the physician with the most accurate information about your health status. Now, as you can see, it's sectioned out. We have personal and lifestyle. We have drug allergies, what medications you currently have an allergy to. We have medication details. What are the current medications that you're taking? Medical conditions. Maybe you were diagnosed with diabetes last year. We would list that here. Surgery history. Have you ever had any surgeries? We would list it on our platform. And then, of course, your family history. Just like when you're in the doctor's office, they ask, has your mom or dad ever had any diabetes, high blood pressure, heart condition? We're going to do the same. And just as Kelly had mentioned earlier, we have the ability to store medical images on our system so that the physician can review it when speaking to you. Because all of our consultations are performed over the phone, wouldn't it be nice for the physician to look at the rash on your leg? Maybe you're having some joint swelling. Maybe you have a lash on your finger. You're not sure if you need to run to the hospital and get stitches or just throw a Band-Aid on it and keep going. Take a quick picture, load it right here on your profile, and the doctor's able to review it. As you can see, someone had a rash. Why I put this here is because I want you to know that our system is HIPAA compliant. If you upload a photo onto our platform, you don't have to worry about that photo going anywhere else. We follow all HIPAA guidelines to make sure that no one has access to your information, except when you call in and you give us that permission to log in. What we did for you, you can always log into your profile and view any of the previous consultations that you've had with our physicians. Maybe you're going to your primary care physician and you said, well, last month I had strep throat and I got some medicine from a doctor on the phone. Well, he's going to say, who'd you talk to? And what did he diagnose you with? And what medication did he give you? Well, the average person is not going to know that information. So we make that, again, very easy for you. All you have to do is either log in or you can pick up the phone and call in, and we will fax these visits right over to your primary care physician so they can have a record of exactly what we did. Okay, powerful scheduler. Until you use AmeriDoc, you really won't understand how convenient it is. I'll give you an example of myself. I was on vacation about a month ago in Florida. Michelle was still there. Went to Disney World. Of course, there's lots of Jeremy kids there. My kids brought along with them, riding around. We wake up the next morning, and my 8-year-old daughter has 104 fever and a sore throat. Well, I can call my doctor in Texas, but he's going to say, Steph, I'm going to have a problem sending it to a pharmacy in Florida. If you've ever tried that, the pharmacists don't quite like it if the doctors aren't licensed there. So I picked up the phone, called in. I have kind of a status over there, so I get quick service. About 2 minutes, the doctor called me and said, what's going on? He gave her amoxicillin, and shoved it down her throat, went on to the next Disney park, and said, don't complain, we got you fixed now. And my daughter was like, oh my gosh, I didn't have to go to the doctor and get a shot. Oh, thank you, Mom, thank you, Mom. So, this is great for kids, for moms, for dads, for the working person, for the stay-at-home person. Everybody can benefit from our product. Okay, another great feature. Let's pretend that you call your doctor's office right now. If I asked each of you to pick up the phone and call your doctor's office and schedule an appointment for 7 o'clock tonight, I would bet each and every one of you that you would not see the doctor until 7:30. Am I right? You don't go straight back and see the doctor. You sit in the waiting room. Then after that, you're going to go sit in the room and you're going to wait again. With AmeriDoc, it's totally different. If you schedule an appointment for 7 o'clock tonight, at 7 o'clock our system automatically dials you on the phone, and when you answer it, it's the doctor on the other line. He's going to say, oh, Mrs. Jones, I see here you have a sore throat and a fever, blah, 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 blah. And he's going to begin his assessment. He's going to put together a treatment plan and more than likely call you in a prescription to your preferred pharmacy. So why is that important? You're working during the day. You need an appointment at lunch when you're on your lunch break. You don't have to worry. It's going to happen at that exact time. Preferred pharmacy. I used this again in Florida. I didn't know where a CVS was. I don't live there. With our system, we can search by any pharmacy name as well as any zip code. So as you're traveling and you know that you're at the Marriott downtown and you look on the piece of paper and find the zip code, we can actually search and find a pharmacy within a 2 mile of your zip code. And we can send your prescriptions to that preferred pharmacy. Well, pharmacies are bought in a database within a technology company. We buy them as a whole. And we all know that CVS, Walgreens, Hy-Vee, Publix, all of these chain pharmacies pop up on every corner every other day. So if a patient is traveling and they say, hey, I really want to use the CVS that's right next to me, just opened yesterday, we can actually add that pharmacy to our database so we never have to deny you of the pharmacy of your choice. So no matter where you're located, we can choose the pharmacy that you would like. Free, in your back health portal, you have the ability to utilize a symptoms checker. You can click on the little guy and say, hey, I have a hurt shoulder. It will give you information on shoulder pain, and you can then investigate and relate your symptoms to that to go see your doctor. We have health tools, we have pregnancy tools, maybe an ovulation calendar, maybe a BMI calculator. All of that is available free right in your back office. If any of you have used AmeriDoc before, all you have to do is call in, request that login information, and you can access this information. Credit card. If you have a monthly fee or a consultation fee with your plan design, you can actually store your credit card information on our platform. So each time you call in, you don't have to say, oh, hold on, let me go get my credit card so we can charge this consult. We can store it right here on the platform so you never have to run back and get it. All right, family members. Here we have the ability to add family members. If you have a family plan, there can be the primary, and you can add 5 dependents to your plan design. It's pretty impressive. We don't care if it's Aunt Sally or Cousin Joe or Billy Bob down the street. You can pick 5 people to add to your plan design, and all of them can be serviced right from your account. We keep our doctors happy. They love telemedicine. They think it's the future of healthcare. If you look at the way technology is going, the crisis that the medical world is in at this point, you will know that they have no choice but to look at telemedicine. The majority of our physicians are working physicians. They are working in emergency rooms. They have their own urgent care clinics. They have a primary care clinic. And they take these consultations in between their normal patients. Majority of our physicians are licensed in multiple states. Our medical director, Dr. Muhammad Imran, he's licensed in 16 states. So he's taking consultations from 16 different areas. Majority of you, I think, have even consulted with him that have stopped by the booth and told me. We target 4 types of physicians. We have internal medicine physicians, emergency medicine, family practitioners, and pediatricians. So if you call in for your child, we are going to get a pediatrician on the phone for you. If you call in for you, then you will be given either an internal medicine, emergency medicine, or general practitioner. All of those 3 will treat the adults. So our physicians happy because we pay them great money, and it's convenient. They can do it right from their home, sitting on the couch with their family, and the happier we keep them, the better quality of care, makes happier and healthier patients. How everybody stays healthy: pick up the phone, call into AmeriDoc, schedule a consultation, we diagnose you, we treat you, we manage your illness, and that's the circle at AmeriDoc. We are here to help you with all of those common and acute illnesses. All you ever have to do is pick up the phone. And of course, I want to thank all of you that have used AmeriDoc. We've done lots of great things with you. And I'm right across the hall in our booth, so all of you feel free to come up there. I've got some nice brochures that you can show to your prospects. Tells you what conditions we treat, when to use AmeriDoc, why you need to use AmeriDoc, and it helps you when you're selling. Thank you guys.